everyone! So today is Project for Awesome, and I will be talking about the Reproductive Health Access Project. When I learned about the birds and the bees in school, I did not, as a cisgendered female, learn what my body would mean for my future. We were educated on various types of birth control, but we weren't told about the side effects. I knew abortion was a thing, but had no clue what it entailed. I knew I would grow breasts and hair in places that I wouldn't really like. I knew I would get my period, but I had no clue that my period would stop and what menopause really meant. After a few years, we forget what little education we had. We remember that we had an electronic baby that would cry all night, but we don't remember that sticking keys into a baby won't really stop it from crying. Of course, this isn't limited to health class. Anyone who watched Jeff Foxworthy in the mid-2000s knows that an adult isn't really much smarter than the average 5th grader. Learning about reproductive health is a challenge, and most of what I've learned has come from social media and movies and TV. I learned about abortion through Juno, and I learned that sex doesn't have to be painful from Tumblr. There are severe gaps in our education, and we all know it. As an adult, there is one place we can go to get information on health, and that is the doctor's office. However, when was the last time you went for a physical and asked about your reproductive health and got a real answer? When's the last time your doctor asked you about more than the regularity of your periods? The Reproductive Health Access Project aims to integrate reproductive health and education into primary care, aka your regular doctor, the one you go to for physicals and flu shots. The three key areas are abortion, miscarriages, and contraception. These three areas have widespread misinformation throughout the United States. By working with primary care physicians, the RHAP can work to normalize these things in communities that don't have access to them. By having your doctor discuss your options with you, you realize that you do have options. You're freer to ask questions that may have been taboo before. You are better able to understand things like miscarriages, which happen to so many women, without relying on hearsay. In addition to lack of education, there is a severe lack of resources when it comes to accessing women's health in the United States. This is where the Reproductive Health Access Project comes in. Their main goal is accessibility in all forms, from abortion clinics to contraceptives to answers to all of your questions about them. One of the best resources that the RHAP has is their network. They have a network of pro-choice physicians, peer-to-peer support, and training. While their network is mostly based on the East Coast, they are working very hard to expand throughout the United States. Through this, they have also developed the Physician Matching Project. They understand that there is a severe lack of distribution throughout the United States of abortion providers, and they work hard to make sure you find exactly what you're looking for. They are working to create a clinician corps to help women access everything they need in terms of reproductive health. In addition to their main goal of working with primary care physicians, they also work with various other organizations on a federal level to advocate for reproductive health. This is important now more than ever, when women's health is at the most risk that I've seen in my lifetime. I hope that this Project for Awesome, you vote for women's health. I hope that you vote for real positive change in both your doctor's office and in federal law. Please vote for the Reproductive Health Access Project. The link to vote is down below, as well as the link to the Reproductive Health Access Project's website. It is such an important cause and organization, and I really hope you consider giving to them. I hope you enjoyed this video. If you didn't know, I'm creating a new video every day in December, so be sure to subscribe if you liked this one. Of course, do that after you donate to Project for Awesome and after you vote for this video on the Project for Awesome website. And I will see you tomorrow. Bye!